we're ready to get started. I am excited to be able to introduce Dr. Kristie L. Dr. L has been conducting research and practice on the health risks of climate variability and change for 30 years, focusing on estimating current and future health risks of climate change, designing and implementing adaptation policies and measures to reduce risks, and estimating the health co-benefits of mitigation policies. She supported multiple countries in Central America, Europe, Africa, Asia, and the Pacific in assessing their vulnerabilities and implementing adaptation policies and programs. Dr. L is absolutely a pioneer in the field of climate and health. So with that, I would like to welcome her.
Thank you for the kind introduction, and thank to all of you for showing up. Albert, you're not late. The previous person used the room right to the last nanosecond. So I'm going to talk about how do we know. There's lots that's written about climate change and health, and we're following a similar trajectory to what's going on in other sectors. And the fundamental question is, how do we know it's climate change? Important for our discussions, important for all the framing on climate change and health is the figure on the left. It comes from the Intergovernmental Panel on Climate Change. It acknowledges that mostly when we think about climate change and health, we're thinking about the future. Futures are inherently uncertain. Risk is probability times consequence. And so recognizing that we are focusing on risk. And in the framing of the IPCC, there's three major factors that contribute to risk. I'll make it four. The first are the hazards created by changing climate. The second are the who and the what who are exposed to those hazards, recognizing that exposure varies significantly from place to place and over time. The third is the underlying vulnerability. In health, it makes sense to divide that into susceptibility to harm and the capacity to manage. And this is critically important because we don't just look at climate change. If you focus only on the hazards, you're missing the bigger picture. You're missing all of the components that can contribute to or ameliorate the risk. Because ultimately, this is about improving people's health and well-being. The figure on the right, you've probably seen there, I don't know, probably there's 100 figures showing changing climate interacting with a whole range of demographic, socioeconomic, environmental determinants of health, which then influence the exposure pathways that many of you study here at the school. And underneath are really a very few of the climate sensitive health outcomes. There are hundreds of climate sensitive health outcomes. The literature is quite narrow. And that is because there's been almost no funding in the field. Everybody complains there's not enough funding. I understand how that sounds, but truly this field does not have funding. And so the opportunities for looking into this broad range of outcomes that are being affected by climate change has been so small, there's just enormous opportunities going forward to look at a whole range of issues that haven't been addressed. I put in the key conclusions from the IPCC chapter in case anybody doesn't remember those. The headline finding, of course, is that climate change is already adversely affecting the health and well-being of people around the world. And that's much of what I'm going to talk about now. And then you can see the categories in which we did the assessment and much more literature on the observations than on the projected risks, but that's just the overall summary. Fine. All right, you're not going to cooperate. I can make this happen. We're talking about how do we know? And so I thought it would be useful to go back to the Bradford-Hill criteria. How many have memorized the Bradford-Hill criteria? Have all of you seen them in class? Unfortunately, there's too much literature right now in the field of climate change and health that does not satisfy even some of these criteria. And that's not being widely acknowledged, which is problematic. That the field at the moment is full of studies that do simple correlations. I've got a data set, I'm gonna correlate the outcomes with temperature, with no etiology, no possible mechanism, and then publish it as if it's some kind of causation. And so it's good to remember that these are the standards that we use in epidemiology when we think about causation. The standards are a little bit different, but not as different as you would think in other fields. So other fields have similar kinds of criteria that they use for causality. And I'll mention in a minute or two that the fields of detection and attribution and of health have intersected for a while. I wanted to start with an overview of detection and attribution. These are slides I stole from Ben Santer when he was given an award by the American Meteorological Society for his significant contributions to this field. And he's doing this from the climate science perspective and going back to different decades of where the understanding stood about the extent to which greenhouse gas emissions were altering our weather patterns. One of the terms in here, SM, the signal to noise ratio, and then fingerprint is a typical approach used in the climate community of looking at the extent to which, again, our changing weather patterns are because of greenhouse gas emissions. And it looks for fingerprint. They do fingerprint analyses. It's not just global mean surface temperature, but it's also looking at precipitation, it's looking at ice, it's looking at ice cores, coral reefs, how they've grown. There's lots of fingerprinting that's been done, and that's what's contributed to the understanding of detection and attribution. Should have started with, does everybody know what detection and attribution is? No. So detection and attribution are sophisticated statistical tools that ask two questions. The first is, has a system changed compared with a baseline? And that I'll mention multiple times. Baselines are really important. In climate science, there's 30-year baselines. They're called climate normals. They change every decade. And so there's baselines you can compare today's weathers to. And so the question is whether it's changed. If you've detected a change, and this is a signal to noise ratio, that you know that there's a signal and it's a strong enough signal, you can measure it over the noise of the weather system. The second question then is, to what extent is this change attributable to climate change? It's like all the kinds of attributable fractions that we use in public health to think about what proportion. So you think about heart disease, the key drivers are blood pressure, smoking, overweight, and each contributes some amount. And the similar question of, when you're thinking from the climate perspective, of how much of a change is because of the emissions and how much is natural climate variability, knowing that weather varies from year to year. And if you have a question, stop me, otherwise I'll just keep going. Okay. So these are the Intergovernmental Panel on Climate Change reports, from the first one to the most recent cycle, the 6th assessment cycle. And then put on here the conclusions. So the very first report, that it's not likely for a decade it'll be possible to do detection and attribution on anthropogenic forces on the planet. So that is about 1990. You come over here to the 5th assessment report, it's extremely likely. So in a very brief period of time, for those of you who look at scientific advances and how quickly fields change, this field has changed really, really fast. It's both because of the sophistication of the methods, but more important, it's because of climate change itself. And so in 2021, when the Working Group 1, the physical science report came out, which is just 20 years on from saying it's going to be decades, it's now unequivocal. These statements are because of detection and attribution analyses. These are the analyses that give you the causality for anthropogenic climate change. And so from Ben's perspective, how is progress made? I think this is useful to put in because health is at the beginning of thinking about detection and attribution. The worldwide corpus of studies on health detection and attribution is less than 20. Not for want of trying, but finally that's going to shift. Improved models, better understanding of all the confounding factors that we know need to be taken into account. And there's a lot more for health. Better records. It's pretty hard to try and figure out if there was an impact of a heat wave in Africa on health when you only have monthly data. And it's on paper records. So critically important to have better records. There's been essentially from the beginning for the climate models, they're viewed as community activities. People share their models, they share their modeling results. Under the World Meteorological Organization, there's an official collaboration across climate modelers. And so working together has made a really big difference. They have the infrastructure for sharing. You can go and download climate data. You have to be able to download all of it because it's so large these days. And you don't understand parts of it to use requires a lot of sophistication. And then the theory, the modeling, the data, and these fingerprint methods all come to the same conclusion. And so Ben's really fond of the term consilience, but it's basically converging on conclusions from disparate sources of information. So again, this is a summary of detection and attribution. I want to emphasize a couple of things. Again, a baseline. There has to be a reference period. And this is a place where health has been pretty weak. We don't have reference period. We do trends over time. We're very good at doing those kinds of analyses, but not comparing two different points in time because of the confounding of the strength of our health system determines health outcomes, access to healthcare. And so it's very challenging. I give you that, but there's also been limited effort to develop any baselines, which is going to make it very difficult for things like adaptation to tell if something's effective if you don't have a baseline to compare it with. Then the attribution is looking at that partitioning of the causal factors. In 2005, 2006, there was an IPCC expert workshop on detection and attribution that included Shari Kovacs and myself, two health experts. There was maybe 80, 90 people at the meeting. There was folks on hurricanes. There's lots of different expertise at the meeting. And we brought forward the kinds of analyses we do in health for doing this partitioning of causality. And that's now part of the methods. That wasn't part of the methods before. It was one of the examples of you need transdisciplinarity because in fact it does make quite a difference. In thinking about detection attribution, the climate scientists have two basic set of approaches. One is for extreme events and one is for changes in trends. Almost all of the work in the climate science has been on the extreme event. And these are the steps in an extreme event attribution for health. And basically, for all of the impact sectors, most of the detection attribution is fundamentally two-step. The first step is the climate scientists do the detection attribution on the event and say, yes, climate change influenced that event. It's quite interesting to go back and look at studies from the climate side of detection attribution. There's lots of events where there's not a climate change signal. It's a climate variability signal, which is naturally occurring. And so you need that assessment of, is this event worth looking at? If the event is worth looking at, then on the health side, you also have to do a detection. Has there been some kind of change in a trend? And then go to, when you do the attribution, you're now doing the attribution based on what you took from the climate model. And that's the way most of this has worked. but there are some different examples I'll show. So that's basically how this is done. It sounds simple, it's complicated. The first example I'm going to give is the Pacific heat zone, because it was in the Pacific Northwest. So first of all, for those of you who follow your broadcast meteorologist, temperature records are typically broken by tenths of degrees, right? Today's a record because of the tenth of degree warmer. We were 10 degrees. It just had not happened before that there was that large of an anomaly. A second factor was important from my perspective as a public health professional is this was accurately forecast. Nobody believed it. People could not believe there would be this big of an anomaly. Seattle, King County did not have an early warning system. People didn't believe the temperatures were going to be this bad. Temperatures are that bad. The county, the city really stepped up and did everything that they could. And yet, when we finally got all the death certificates in, there was more than 440 excess deaths in the state from a few day event. There was a rapid detection attribution study of this event that said this event was virtually impossible without climate change. And so this is changing the narrative, just like it did in the climate science of now it's definitive, people are dying from climate change. We can quantify that people are dying from climate change. This is not saying there's an association between high temperatures and mortality. This is going to a minister of health and saying people are dying from climate change. That makes it a mandate in the Ministry of Health that they have to do something. And so these studies are critically important for moving policy, because there's so many ways that policymakers say, this is the basket of problems I'm dealing with, and it's enormous. And why should I focus on something that's not a problem today? And that's one of the reasons it's been fairly slow in the health sector to take up adaptation. These are the studies that tell you you have to. It's now no longer an option. To make a couple other comments about that, focusing obviously on health, focusing on mortality. And one comment is a complete aside, but I still wonder why when we have heat waves, people don't frame them as mass mortality events. If anything else, it caused 440 deaths in about 4 days, it would be a mass mortality event. But that's not how they're covered, in part because we don't know the deaths until much later. The second is mortality is only a small slice of all the impact. This happened during the height of our cherry picking season. We're one of 5 states that have protections for outdoor workers. And there was quite a bit of coverage of what the orchards were doing to protect the outdoor workers. I remember one orchard, part of the cherry picking, there is a large walk-in chiller basically, and had all of the workers spend time in there to make sure they could get their core body temperature down. They really worked to try and protect the workers, but most of the crop was destroyed. Between south of Seattle up to Vancouver, BC is an area called the Salish Sea. That those coastal tribes live along this area. One of the major industries is oysters. And it was estimated at low tide, because the temperatures were so high, 1 million mussels, clams, and oysters were literally cooked. And that's food security issues for some of these sovereign nations. And so the wider impacts are much greater, but right now we've got some data on mortality.
Chris?
Yeah.
Can I ask a question?
Please, yeah.
So did the climatologists who work on this try to say, in the absence of climate change, this would have been like a 2-degree record instead of a 10-degree record? Or
Yeah, this is pretty interesting. So what they do, so if you've ever seen the output of climate models, there's these big cones of every climate model looks at the 4 major components of the weather system and has code from first principles of how, what are the interactions with land, with the ocean, with the cryosphere, with ecosystems. And they look at these components and develop these models that describe each one and how they interact. I remember from the first US national assessment, one of the climate models that was used had 1 million lines of code. And these are all from first principles. And so each one is a little bit different. One will have 23 layers in the atmosphere, another have 30 layers in the ocean. It depends on how these models are written. And so when you give the models the same initial conditions, they come out with different ranges of responses. And you add into that different levels of greenhouse gas emissions, and you get these big cones, and here's all the projections. So what has been done for most of the extreme event analyses is the climatologists look at this wide range and they sample it. So of X number of runs, how many were as extreme as this event that was observed? And that's how most of these analyses are done. This was so extreme, it was outside the cone of all the models, which says the models are not going extreme enough. And it took a significant effort. If you look at the author team, it's like 35 or 40 people, trying to understand why this was outside, what that means for models going forward, and then what do you say about this event? And that's why it's virtually impossible if the climate models, it's not even in the range of the climate models, and they include pretty extreme events. That's a good question. This is a detection attribution study that's based solely on modeling. It's from a large collaboration of researchers in 43 countries, over 700 locations, have heat-related mortality data, or at least excess mortality data, for about 20 years. And took that and matched it with a large project in the climate community on detection and attribution. And so pulled in the detection and attribution on changing trends in temperature, and then the changing trends in mortality. And this is the result for the 43 countries. Overall, so over the last couple of decades, about 37% of all heat-related mortality is because of climate change. There's papers that came out of Spain over the last 2 years. In 2022, the estimate is about 60,000 Europeans died from the heat. Okay, about 37% of that is because of climate change. Last year was not quite as hot, so it was like 47,000 of Europeans died from the heat. But again, the numbers are really quite large. And as you look around the circle, you see some regions have fair representation, other regions have little, and there's only one country for all of Africa. So there's a lot that needs to be done in terms of coverage. You can also see variability from place to place. So there's a lot that can be learned about vulnerability, about what would you do to reduce that vulnerability by exploring this further. But this then incentivizes doing that research because this is because of climate change. And Albert, I put this in because I knew you're going to be here. I'm not going to go through this, but temperature, precipitation affect the development, the survival, and the reproduction of mosquitoes and ticks, which is why climate change is a factor in vector-borne diseases. Separately, temperature can affect the replication of the pathogen. So the modeling is more complicated because you have to have those interactions, understand the constraints, understand the opportunities then. Dengue has been a huge issue this year. These are notification rates per 100,000, just showing you how many countries have very high notification rates. And it's not just confined to the Americas, but I will confine my comments to the Americas. This is a situation as of a little over a week ago. More than 12 million cases. Last year was 4.6, which was a record. Down here is the epidemic curve. Yellow, last 5 years. Blue is last year. The red is today. The epidemic started before the normal start of the season. It lasted longer and obviously a huge peak. This is consistent with lots of research in that the mosquito that carries dengue, Aedes aegypti in the Americas, is extending its geographic range. It's extending its seasonality. And with warmer temperatures, there's more mosquitoes, so you intensify transmission. So this is not unexpected. It's still awful. It's issues the community's been talking about for quite a few years. And this just illustrates what can happen when you have these changes in temperature, changes in distribution. And Albert, we talked about this last night, so I put this in. There's a modeling paper that's in a preprint showing the marginal influence of temperature. As I said from the beginning, it's not all climate change. There's other things going on. This paper did not take into account immunity because it didn't have data on immunity, which we know is important. But you've got health expenditure, population density, and the incidence. And you can see very different distributions of the marginal effect of temperature in these four categories in countries with low and high transmission and how they vary with temperature. Because we know as it gets hotter, then the mosquitoes, at some point, the mosquitoes stop breeding when it's too hot. And so taking into account these nonlinearities makes this a relatively sophisticated modeling effort. And then use this to then do detection and attribution. And I'll focus here. These are the countries they looked at. This is the estimated percent of dengue due to existing climate change. Peru, Mexico, Bolivia, it's 35 to 40%. Brazil is about 35%. And it's not true in all countries. And you can see in some countries it's relatively low. And so understanding these complexities then makes a difference. This is where, certainly in Central and South America, talking with ministries of health, talking with funders of adaptation, that you can justify getting funding when this is because of climate change. The Green Climate Fund is the biggest fund. And you can only go to the Green Climate Fund for issues that are because of climate change. They will not fund issues that they think development should cover. And that's the restrictions put on them by their funders. And so it just gives you, these are places where absolutely they're eligible to apply for funding to find ways to help prepare for and decrease these burdens because of a change in climate. Another vector-borne disease. I keep looking at this clock for some reason. It says it's 5 minutes to 8. Could be, I'm jet lagged. I'll look at Lyme disease. And Lyme disease is interesting because it's got a very complex 2-year life cycle. And from the beginning, there was a whole group of people, not that there's many people in climate change and health, but of the few people in climate change and health, it was felt Lyme disease would not be something where it would be possible to see a signal because you've got this complex 2-year life cycle. It's turned out actually to be really quite simple. It has a complex 2-year life cycle, but it comes down to, can you get the tick from one place to another? The birds do that for you. And then the behaviors are all temperature dependent. And so it just comes down to temperature is doing a pretty good job predicting what's happening with Lyme disease, particularly in Canada, where a lot of work has been done. In Canada, Lyme disease did not used to exist. And so the baseline on Lyme disease is 0. And I'll show you the map in a minute. I put this in as well because it makes the point. It's not just because you've got a mosquito there. First, you have to get the mosquito or the tick to a location. It has to establish itself. You then have to introduce the pathogen. And so the vector control programs are critically important because they can give you a couple-year lead time that you've got ticks and mosquitoes moving into a region, so you can set up that control program. It's not just overnight, suddenly you're going to see a big increase in one of these vector-borne diseases. There's been a detection and attribution study. Again, it was a 2-step. It was looking at the changes and the patterns in Lyme disease, which I'll show you in one area of Ontario, and then work from Environment Canada on the changes in temperature. So Environment Canada said, yes, temperatures have changed because of climate change. And this is just over 6 years in Eastern Ontario. These are actual cases. And you can see the rapid spread and intensification of the number of cases. And so these kinds of patterns are expected with the rapid changes in temperature as we've had vectors introduced, as pathogens are moving around. And in the way of saying there's lots of opportunities here. in detection and attribution. There's also ways to think about using qualitative data. I put this in, it's in a paper I helped lead. It was interesting because there's discussion back and forth between the author team, the journal editor, and the reviewers who wanted this example to be removed. It was qualitative and the total numbers of people affected were small. My response was, when you have 3 or 4 people affected in a community of 90, that's a huge proportion. And we have to start thinking about qualitative methods. And this is just one example of, we had this qualitative data on the number of open water holes was uncountable because there's been so much melting in the Arctic, and tied the loss of the ice roads in with some of the consequences. There weren't human health consequences, but it talked about the challenges of getting food into these very rural communities. It's not just the ice roads, the planes can't land when you've got so many boreholes open. And a range of issues that will affect human health. And so we put that in because it is important to think about the qualitative data we have access to and how we can better use it. Of course, I've been talking issue by issue. That's what we always do in climate change and health. We separate out extreme events, vector-borne diseases. It all interacts. I really like this diagram from Luke Kemp, thinking about this like a balloon to help show the kinds of interactions. I thought was a very clever way to do it. On the right are some examples from a paper with Jan Semenza of compounding and cascading risks, and thinking about how these interactions are taking place. And how can we best study these, quantify these, put economic costs on those to help increase policy uptake. I'll wait till Albert takes a picture. Along those lines, an area I know several of you are working on is wildfire. I live in the West. It's warm. You got wildfires. And the wildfire exposures are increasing. From the Lancet Countdown that shows the increase in the exposures to PM 2.5. A couple of comments. For those of you who don't work in air pollution, the major concern with air pollution is particles of various air toxics. And those are measured by their size, not by their composition. And the most important one is PM 2.5, and that's because it will, when you inhale, it goes deep into your lungs. It can stick on your lung tissue and be absorbed into your body. Smaller particles come in and out. Bigger particles get stuck in the esophagus. So this is the one that really goes deep into the lungs. I don't know how many thousands of papers on air pollution focus on PM 2.5 from tailpipes. PM 2.5 from wildfire smoke is different. The toxicology suggests it's at least 3 times more toxic. And you think about that for a moment, it's not just the trees that are burning, it's the cars, it's the buildings, it's the petrol stations. You start thinking of everything that you've seen burn. And so there's a lot that's in those particles that's much more hazardous. An area where there's almost no research is, what does it mean to have extremely high exposures over short periods of time? The air pollution studies are focused on Beijing, New Delhi, where there's months worth of high air pollution from automobiles in particular. If you haven't seen Purple Air, we use Purple Air. Two years ago in my neighborhood, the reading of PM 2.5 was over 200 for 2 solid weeks. Anything over 60 is unsafe degrees. But we don't know what happens when people have those short-term extremely high exposures. It's got to be damaging to lungs. There was a community in Los Angeles. Some of the fires were around Los Angeles. Their air quality reading was over 750. These are opportunities for research to go and see what really are the consequences for these very high but shorter term exposures, which unfortunately there's going to be more of.
Can you work us through this? So the upper map
The mean yearly exposure to PM 2.5. And this is the trends.
So, for example, in Africa, large fine exposure that you see in sub-Saharan Africa.
It's
is in
sub-Saharan
sub-
dust. Yeah, it's wildfires, but I think they might be picking up some of the sub-Saharan dust as well.
Right, and that's the top map, right,
Right,
up there, yeah. And that's not just slash and burn farming, that's,
wildfires.
well,
It's from big databases. There's people collecting these big databases on all the wildfires. I forgot the name of the database at the moment, but taking advantage of some of the databases that are out there to understand.
making assumptions of how much PM 2.5 is being produced by a wildfire. With the wind and all, yeah.
But it's also, there's measurements most places, you can't always get access to them. In some countries, measurements of PM 2.5 are considered secret, confidential. And so you don't have access to those. It's getting as much data as possible to understand what is going on with wildfire smoke. There's lots of work, of course, in ecosystem research. Don't wear a watch. How much time do I have?
It's go for it.
Okay, I'll spend a couple of minutes on this. So these are iconic figures in the IPCC. They go back to the Framework Convention on Climate Change. Article 2 of the convention says the ultimate purpose of the convention is to prevent dangerous anthropogenic interference with the climate system. That language was negotiated across 195 countries. Almost all of those countries have signed on to the convention, so it's negotiated language. The ink is dry. UNFCCC Framework Convention on Climate Change turns to, at that point, new Intergovernmental Panel on Climate Change, had only been around a couple of years, and said, help us define dangerous. Dangerous is a subjective term. There's no objective way to say, you think about dangerous, for example, in terms of air quality, but for most things, that line is pretty fuzzy and it's subjective. In the third assessment cycle, the TAR, as it were, in the TAR, there's a whole chapter devoted to this and trying to develop a framework for understanding dangerous anthropogenic interference with the climate system, and came up with something called reasons for concern. And the reasons for concern relate back to this dangerous anthropogenic interference with the climate system, and did a complete literature review at the time to summarize what is understood about the risks. And developed figures that look pretty much like this. First of all, the color scheme is such that we all call them burning embers, and so you'll see in the literature reference to burning embers. The zero line are pre-industrial temperatures. The y-axis is increase in the global mean surface temperature above pre-industrial. Where the color is white, it means it's not possible to tell scientifically that there's been a change and a trend in the system of interest. And these are obviously health, although with heat. On the left, the white, you just don't know. It's not that there hasn't been a change. We don't have enough data. We don't have a long enough time series. It could not have changed. We don't actually know scientifically. The point of this exercise is, where do you transition from different levels of risk? So at white, you don't know. At gold, it means the system has changed. And at least some of that change is because of climate change. So the transition to gold is detection and attribution. When it turns to red, the risk is high. When it turns to purple, the risk is very high. Most of these, not this set, but most of these are developed through Delphi survey methods, expert judgment. And a lot of time is spent understanding where each of the scientists think those transition points are in terms of temperature. So that's the real scientific effort. These were actually based on a literature review that no one will ever do again. The paper has 75 pages of supplementary tables. The large dots has to do with the program we use. That just gives you the level of confidence in that transition point. And then we did something for the first time is we did these under 3 adaptation scenarios. A world with high challenges to adaptation mitigation, a world that has medium challenges, and a world that's aiming to sustainable development and the challenges are low. And one of the consequences, as you look at this, you can immediately see the critical need for both adaptation and mitigation. That if we don't do both, we're not going to be able to get risks down in the future lower than they would be otherwise. And so if you go to the summary for policymakers for working group 2, which is impacts and adaptation for the IPCC, there's a 2-page spread showing all kinds of burning embers from different perspectives. When that went through the approval session, the major comment from the countries was, why don't you have burning embers for this issue, for this region, for this? And so these are going to become much more common going forward. On top of it, they're a great communication tool. Once people understand the rubric, you can look at this and understand without going into all the details of different papers. That you can say that this is the consensus of what is understood about risk. Are there questions on that? Okay, they're all let me know. There's another paper in preprint on opportunities and challenges in extreme event attribution from a large group of climatologists thinking about ways that they want to move forward on their side from detection and attribution. And it's worthwhile if you're working it to look at this, to think about where they're working, where they're trying to make advances. And so they're thinking themselves about what they want to do with their statistics, with their methods, their tools, and how then we can work more closely with them for health and bring that into what we do. I mentioned this at the beginning, but I want to emphasize it again. We all know the inequities inherent in climate change. Detection and attribution has not done much in terms of focusing on those inequities, and I think there's ways that that could be done. And to get a better sense of how the exposure and vulnerability that varies across populations then has consequences. This is highly relevant for the negotiations in terms of loss and damage, and also for the global goal on adaptation. And then finally, I wanted to mention something, if you don't know it, it's the Climate Shift Index. It's a relatively new product from Climate Central. And for every single day, going back to sometime in 1980, it looks at the temperature in a location compared with the long-term average. And then basically uses, if the temperature is more than 2 standard deviations away from the long-term average, then climate change influenced that temperature. And as you're doing studies in particular locations, you can use something like this because it's detection and attribution to say how did these changes in warmer temperatures throughout Central and South America affect the outbreak of dengue, which is the detection attribution study I showed you. There's lots of ways to use this information in looking at a variety of different issues. So you should be aware of it, freely downloadable. And it's for today, amazingly. I downloaded it late last night. It was already for today. Thank you very much for listening. I look forward to the questions.
Questions?
I could not possibly have been clear on everything.
First of all, thank you so much for coming all the way from Seattle.
Yeah, no, my pleasure.
I was very surprised by what you shared about King County, how 400 people died because
In the state of Washington, but yes,
right, in the state.
but we've got population density, so.
Okay, and then you mentioned like people just didn't believe that it was gonna be that hot. So what do you think went wrong there? Was it like trust in the system, or just like the way it was communicated, or like what?
No, it was well communicated,
Yeah.
but it was so extreme.
So how do you, what should have been done differently?
No, I think there's ways, I personally strongly advocate for stress testing, because people as a species are terrible at looking into the future. Absolutely terrible. My favorite story is about Thomas Watson when he was head of IBM. the first personal computer was developed by IBM and was presented to Thomas Watson, who was head of the company. Here's somebody paid a lot of money to have vision for the future, where the company is going to go. And he purportedly watched this demonstration and said, that's great, but the worldwide market for PCs is 10. When my kids were at home, I think I cornered the market. I mean, it's just, how many devices do you have in your own possession? I just could not see the vision of where this is going to go, and that's been a problem throughout history. And in disaster risk management, it's a lot like the military, where disaster risk management focuses on making sure we could manage the last event without thinking about what the next event's going to be. And stress testing is a way to start breaking that down and saying, no, yes, having an anomaly you've never seen before is possible, and you need to prepare for it.
Mhm.
But that mindset doesn't exist yet, particularly when you look at departments of health that are inherently conservative. They never want to make a mistake. Meteorologists are not much better, right? They don't want to make mistakes, although they have very high skill. It was just so extreme. No one could believe that that would actually happen. But we're seeing more and more when you open up the media every day of how extreme. Valencia, a year's worth of rain in less than one day. And so we're seeing these and changing that mindset of you've got the forecast, you have to prepare, even though you don't believe it could possibly happen. And it's got nothing to do with trust. There's high level of trust. It just, it's so different. And having people think more about how the future is going to be very different.
Hi, well, thank you so much for being here. It's a
Sure.
privilege to listen to your talk. I've been following your work for a long time. So my question is related to what's happening today in Baku. So COP29 is starting, 2 weeks of negotiations. And well, you have told us that the kind of the literature around health outcomes has been on climate change very narrow, and we need more attribution studies. That's clear. However, we have those for climate science, and still we haven't made progress in the negotiation. So I was wondering, I know it's like a difficult question, but like, what do you think we need from the climate and health side of research to really push for change? Is it more advocacy efforts? Do we need to communicate this better, or do we have to keep doing studies on attribution to have this kind of evidence as you were pointing out?
I'll push back quite strongly on that. It depends on what you think success is. And there's lots of ways to think about success. I've been to way too many of the COPs. And even governments that are ultra conservative, that don't want to do anything about climate change, show up. So first of all, everybody shows up. It's actually astonishing. Everybody shows up. And they sit through the negotiations because they know the decisions that are ultimately taken will affect their country. I will also challenge people to think there's 195 countries. Can you get everybody at Thanksgiving dinner to agree on something? It's very difficult. They're all coming from national circumstances. We don't have the counterfactual. We don't know how much progress we've made on mitigation compared with where we would have been. And so there's a false sense in here that no progress has been made, when in fact enormous progress has been made. Often the metric is mitigation. It doesn't look at adaptation. The over $1 billion that are gone for adaptation. We now have a loss and damage fund, which was a hopeless cause 3 years ago. All the negotiations around red deforestation has made progress in some places, not progress in others. And so that's not a question really to ask of this complex entity. And trying to get insight into this is not easy because there's so much that is going on. And yet, at the same time, we are seeing progress. When you look at the number of electric vehicles around the world, projections are by 2030, I forgot the number. The economists did this analysis. It's just astonishing how many electric vehicles there'll be within just a decade. And that it's impossible now to stop it. It's reached a tipping point. It's going to continue. One of the stories I like to tell on we're making progress is I went grocery shopping one day. Do it more than one day, but one day when I went grocery shopping, parked in an underground parking garage. And I'm walking back to the car carrying all these bags of groceries, having those internal conversations of should I kept the cart? Because why am I carrying 6 bags of groceries? And I heard wind chimes. And I couldn't figure out in all of this concrete how I could hear wind chimes. I calculated the distance to the exit. I thought about everything outside the exit. I'm trying to figure out where I could hear this from. Obviously, it took me a while. I didn't hear a single internal combustion engine. They were all electric vehicles, and heaven forbid a Tesla sound like a Ford. They all make different tinkling noise at low speed, and so I heard a bunch of tinkling noises. It sounded like wind chimes. And that's the future. That is happening now. And it's not happening fast enough, and there's lots more that needs to be done. And really focusing our energy on moving forward and recognizing the change that has taken place. One of the nice things in Australia, they have a big adaptation meeting, used to be every year. And part of that adaptation meeting is they give awards to individuals and companies who've made a lot of progress. And it's a lot that's changing, but that isn't what happens in the news, right? The news covers, we have to get down our emissions by this amount, which we're not doing as fast as we could, but we still are making progress. And so it's the media tends to want to cover things in a perspective that it's a disaster, because that's what sells. So taking a step back and recognizing there has been quite a bit of progress. Yeah.
For the sake of time, we're gonna have to wrap up, but thank you again for
My
coming.
pleasure.
If there are students or trainees that would like